Hi everyone, this is Dr. David Pham. I wanted to go over another really special case that we did and we finally finished. We started this in late 2023, and what we're seeing here are primary canines. We did both the right and left, but to be honest, I took way better photos on the right side, so we'll mostly be focusing on this one. And she was born with congenitally missing lateral incisors. So when she did orthodontic treatment, they moved the permanent canines into the lateral position, but they didn't actually change any of the contours of the canine. As a result, we decided to add bonding to it about 4 years ago to make it look more like a lateral. But it's just a big tooth, and so it was much harder to uh, camouflage it, and leaving the primary canines as they were. 4 years ago, the primary canines probably had mobility class 1, maybe 2, and more recently, last year, they became mobility 3. And she's a young patient, so we knew that these canines were going to come out at some point. We just wanted to figure out what we would do to replace them. And as with everyone, we provided all of the options. We'll leave it alone, do a little bit of composite bonding. We can do a bridge, we can do an implant, or we can do a flipper, or leave it as it is. What she ended up choosing was something that I would choose for myself, which would be a implant. Main reason is because I just don't want to harm the nearby teeth. I don't want to, reshape them and do a bridge. So we did the surgery surgically guided, and on the same day we used those primary canines as temporaries. Much harder to do than I expected, just because they're so small. It was hard to even get them to do at the pickup, but we managed, and that was the longest part of the surgery. To be honest, it was just a mess. A lot of resin and acrylic and metal shavings everywhere. So we did the surgery. We put the immediate temps in as well. Then we on the day of delivery, she was so happy with what she saw. She was so glad that she did it, and we are too. Like, now she's able to take care of it like her actual tooth. Um, the nice thing is that we didn't lose too much bone, even though the primary canines were only in the soft tissue, and that could have contributed long term. If she had kept those canines for longer, it could have led to more bone loss because there's no function on them and there's no stimulation of the bone. There was literally no attachment to the bone. So we did it at the right time where we removed the canines, and then we could build up the bone even a little bit more to protect this implant for as long as possible. This is how the full smile looks like as well, and we can see quite a bit of improvement. Really, it's the shape, the size of the canines were spot on. She went for custom shading, and when she saw the lab technician, I'm so glad that she was able to do that because it makes a huge difference. And we just fill in her smile so much more right at the canines because they're bigger teeth, they're brighter, and they're in the right position. At our office, we really enjoy doing cases like this because it's not just about the function, it's about how we can help patients feel more confident about their smile as well, or not worrying about losing a tooth from eating or drinking just like you normally would. Because again, these teeth were mobility class 3 because there's no longer much attachment to them, and eating an apple would not be possible. Eating a sandwich would be, precarious. So we're so glad that cases like these are the most meaningful to us because she's been thinking about it for more than 4 years. this really brings it full circle for us, that we are able to do this for someone that we've known for a long time, that we care about, and she's very deserving of it as well. Hopefully you enjoy cases like this, and the planning behind it, the thoughts behind it as well. I will go through the surgical aspect. This is just about the what we're able to do and why we do what we do. If you have any comments, questions, please leave it in the comments below, and I would be more than happy to answer them. Thanks again for watching.